Dr. Youssef. We are going to be using these instruments here to help drain an Olecranon bursitis that has gotten swollen. What we're needing is some lidocaine with epi, a Depomedrol 40 milligrams ready with a little bit of lidocaine, 18 gauge needle, a syringe, at least a 10 cc, sometimes a 20 cc's, some betadine, some alcohol, and then we're going to be sending it out for culture and analysis. Hi, this is Dr. Jonathan Youssef, Networking for Your Optimal Health. Today we're going to be draining an Olecranon bursa sac. This one has been drained once already, and we're going to be draining it again. What we want to do today is going to anesthetize the area. So I'm taking a lidocaine with epi, syringe, a small amount, and finding the softest area where we may be able to drain it, and then applying the anesthetized lidocaine pinch. Sorry. There we go. And that completes just the anesthetizing process so that we can apply the needle. This is Dr. Youssef. We're going to be applying betadine to the area to make sure that there's no infection. Make sure that it's dry. And the area we anesthetized earlier is located right here. We're using an 18 gauge needle, and we're trying not to put the needle on too tight so that we can pull out the fluid and then switch needles. Okay. I like to hold the Olecranon bursa sac with the fluid so that when I pull out the fluid, as you can see, it's very viscous and fluid is coming out. There we go. And when you pull out as much fluid as you can, you may want to get your second needle ready to apply the cortisone. Oftentimes I might have to remove the needle and put the fluid into the sterile cup, and then once again re-suction to get more of that fluid out. I prefer to get as much of the fluid out as possible. As you can see, in our second attempt, we got more fluid than the first attempt once we got a little bit more suction power. So, keeping in mind, it's not always going to be exactly how you perceived it's going to go, but if you keep at it and you reposition your needle, you'll get more fluid, and now it feels much more flat than previous. Okay, so this is where the elbow looks almost completely flat. Get that fluid out there. I'm going to go one more time to try and drain the remaining amount. Okay, now I've got that remaining amount, and switch needles to the Depomedrol. Okay. Oh, pretty smooth. Okay. so this is completed. This is the fluid, and we'll discuss further treatments with the patient after. Dr. Youssef, we're going to go ahead and anesthetize this area, a little pinch. I like to anesthetize the Olecranon Bursa so that the patient has less pain when we're using the larger needle, because we have to switch over to the 18 gauge needle at this point. The reason why we're using an 18 gauge is to just help get rid of more of the fluid. So there might be, it's very likely that we're going to have more than 10 cc's. So that's why we have this little extra bin here where we can collect the fluid. And then we kind of lightly put the needle onto the syringe. The reason why we put the needle lightly on, in case we have to switch it out for a little bit of cortisone. Okay, so now the area is a little bit anesthetized. We're going to little poke here. And there it is. So again, there's blood on this one here, and we're just draining out the lesion, draining it out. Sometimes I like to squeeze the sides of the bursa to get more fluid out. Okay, and then this is where we twist it off. Chris, if I could get you to hold this over it, because it's going to make drip out. Okay. Okay. So sometimes it drips out. You can squeeze it on the side if you want. You could put pressure on it on different angles to get more out. Now it's looking more like a regular elbow. Flat out. So I'm going to go ahead and try to see if I can get any remaining. Now if there's any remaining areas, I will be able to, there we go. I think that's dried it all up. Now I can switch out the needle once again. Okay, just in case it drips. Okay, now we can switch out for any type of local anesthetic or lidocaine, or in this particular case, we're using a Depo-Medrol. Now it's going to puff it up a little bit more, but this will hopefully help it from coming back up. Okay, and that completes our treatment. Once the patient will be able to put some anesthetize it and do some local care and be done.